Do you need help billing in Sessions Health or TherapyNotes? We can help. Medical Billing Professionals is an approved Sessions Health billing partner and an experienced billing service for TherapyNotes. Do you have to use Sessions Health or TherapyNotes to use our mental health billing service? You do not have to. We have easy online forms providers can complete to provide patient demographics or billing. In addition, we can work with other EMRs like Simple Practice, Valent, Tebra, Notes, and Practice Fusion to bill in our Metasoft software, not in those EHRs. You also might have some other EMRs out there where you can export patient demographics and billing to provide to us. But note, if you're using the Jane app, we can also bill inside of your EMR like we do with Sessions Health and TherapyNotes, so do pay attention to this webinar if you're using the Jane app. Now, not all practices require the same level of service with medical billing professionals. Providers should only pay for those services that they need. Therefore, for Sessions Health, Jane app, or TherapyNotes users, we offer two different levels of service, Platinum and Premium Plus. With the Platinum service, we can handle all billing responsibilities, setting up new patients in your EHR, insurance verification, claim submission, payment posting, follow-up of denied claims, and even a revenue report upon request. So the biggest problem with rejected claims is not setting up the patients correctly. For example, maybe you entered the wrong insurance payer or the wrong ID number. For any new patients, you have three options if using our service. You can set up all new patients yourself in your EHR. If you're using the patient portal and TherapyNotes, on a daily basis, we can download the client insurance form completed by your patients. If you are using the patient portal in Sessions Health, you can advise us when a patient has completed the client insurance form, or provide us administrator access so we can review the forms ourselves. Or you can complete a simple, secure online form on our website. We then will accurately set up the patient in your EHR. If you choose the third option, you can still set up the patient with basic demographics such as name and date of birth so you can schedule the patient. It is highly recommended that you upload a scanned copy front and back of the patient's insurance card into your EHR. If you are using the patient portal, you can require your patients to scan a copy of their insurance card front and back when completing the intake paperwork in the portal. For any new patients or for patients who change insurance, if you are enrolled for our Platinum service, we will verify eligibility and benefits. We will enter the information on the Billing Settings tab for the patient in TherapyNotes or under the Client Information in Sessions Health. Information entered will include the effective date, deductible, including amount remaining, copay, coinsurance, out-of-pocket max, including amount remaining, if claims go to a third-party payer like Carelon Behavioral Health or Magellan, if prior authorization or a referral is required, and also if you need to know if a specific CPT code is covered, such as 90847 or the psych testing codes, let us know in advance. Benefit information is generally entered in your EHR by the next business day. There is a limit of 3 verifications per day and 60 per month, with a fee of $11.95 per each additional verification above 60 during a billing month. For existing patients with the same insurance since the last visit, we offer an optional verification service for $11.95 per verification. This service is designed primarily to see if a patient's benefits have changed for a new benefit year, or if a patient has met his or her deductible or out-of-pocket max for the year. Now, on a daily basis, we will log into your EHR and submit your claims ready to submit electronic and paper. We will review any claims that may have rejected electronically. If we are able to determine the reason for the rejection, we will correct and resubmit. If we require your assistance, for example, the claim denied because the patient's coverage terminated, we will securely notify you of this so you can provide us corrected information. For EAP billing, we are able to submit those claims to payers that allow electronic submission, for example, United, Optum, and Cigna. For payers like Magellan or Carelon that require EAP claims to be submitted via their specific online forms, providers will submit these forms themselves because of the requirement for clinical information. We would recommend for United and Cigna, if you do EAP work, that we set up separate EAP payers such as Cigna EAP and United Healthcare EAP because of the payer-specific requirements for EAP billing. We will also submit any secondary claims to payers if not crossed over by the primary payer. Medicare does cross over most claims to the secondary payer automatically, and we would not have to submit those claims to the secondary payer. We will submit the secondary claim electronically in your EHR if allowed by the payer. But note, in TherapyNotes, you can only submit secondary claims electronically if the insurance payment from the primary payer is via electronic remittance advice. Sessions Health does not have that flaw that TherapyNotes has. In Sessions Health, you can submit secondary claims even if the primary payment for the primary claim is posted manually. Now, we will submit secondary claims on paper with a copy of the primary payer EOB if we are unable to submit the secondary claims electronically. We will also ensure your office is enrolled with all possible payers to receive electronic remittance advice, electronic EOBs, in Sessions Health or TherapyNotes. For TherapyNotes users, on a daily basis, when we log into your TherapyNotes account, we will post all ERA files, but prior to posting, we will review the ERA for any claims that denied, for any that may have denied an error, or where we cannot determine why the claim denied. We will automatically follow up with the payer. For claims that denied because coverage terminated or eligibility was not found, we will notify you to provide us corrected or updated insurance information so we can resubmit. For Sessions Health users, on a daily basis, we will review the remittance reports for the ERAs auto-posted by Sessions. For any EOBs you receive in the mail, you will scan those EOBs you receive that are not also found under ERA in TherapyNotes or under your remittance reports in Sessions Health and securely upload them to our website. Again, you're not sending us all EOBs, only the ones that are not found under ERAs or remittance reports in your EHR. We then will manually post those EOBs in your EHR. For any patient payments, you'll be able to post those yourself. Now, assuming your office is enrolled for our Platinum service, follow-up of outstanding or denied claims that we have submitted is included in this level of service. This is for any primary insurance claims that we have submitted, not secondary, when we post the EOBs from payers if a claim rejects an error, or we cannot determine from the EOB why the claim rejected, we will automatically follow up with the payer. Also, for any primary insurance claims that remain outstanding more than 30 days after claim submission that we have submitted, we will automatically follow up with the payer. If, after speaking with the payer, we require additional information from you, such as notes or corrected patient demographics, we will securely notify you. At least once a week, and preferably every day, your office must provide us copies of the EOBs you receive that are not found in Sessions Health or TherapyNotes under ERAs. For any older claims that your office submitted on your own or submitted via another billing service, or for open secondary claims, we offer an on-demand follow-up service. With this optional service, you complete a simple form online requesting that we follow up on the older claims or the secondary claims with a fee of $12.95 applied per claim that we have to follow up upon. There's a revenue report that's available in TherapyNotes that you can run yourself. We can run it if you want to, but this is very important. There's a flaw in TherapyNotes because the TherapyNotes report is based upon the date of the payment, and this can cause problems. For example, if on Saturday the 15th we run a report for the week that ends on Friday the 14th, and then on Monday the 17th we post a payment from a payer with a payment date of Friday the 14th, that payment is lost for revenue report purposes. If we know you will be using the revenue report in TherapyNotes, the way we get around this is by changing the payment date. In the above example, for the payment received on Monday the 17th, to ensure that payment is reflected on the next revenue report, we would change the payment date when posting in TherapyNotes from Friday the 14th to Monday the 17th. For Sessions Health users, Sessions Health does not have the flaw that TherapyNotes has. Sessions Health actually uses the date of posting the ERA as the date rather than the actual date of the payment, so you do not have the problem that TherapyNotes users encounter. So for the Premium Plus service, it includes setting up new patients in your EHR. On a daily basis, we will review and submit all claims. We'll submit all secondary claims, review and post all EOBs. Verification of benefits is optional, and follow-up of claims is optional under our on-demand follow-up service. We do notify you of all claims that deny an error and require follow-up, so you can follow up yourself or request that we follow up under our on-demand follow-up service. So for the Platinum service fees, there is no setup fee. The standard per claim rate, if you do 0 to 499 claims per billing month, is $3.99 per claim with a minimum fee of $199.95 per month. For larger practices, if you submit 500 or more claims per billing month, the fee is $3.59 per claim. For the Premium Plus service, the standard rate, if you submit 0 to 499 claims per billing month, it's $2.89 per claim with a minimum fee of $99.95 per month. For larger practices, if you submit 500 or more claims per billing month, the fee is $2.49 per claim. Again, there is no setup fee. Now, are you using a billing service charging a percentage? If so, you are probably overpaying. Most billing services charge between 5 to 10% of the amount paid, with the average being 7%. If you are paying 7% and your average reimbursement is $80 per visit, you are paying $5.60 per claim. Compare that to our highest fee of $3.99 per claim for our Platinum service standard rate. If your average reimbursement per visit is more than $80, your savings by using MB Pros is even greater. For example, if your average reimbursement is $120 per visit, you would pay $8.40 per visit to a billing service charging 7% compared to a maximum of $3.99 per claim with MB Pros. Now, if you group your visits together by patient, you can save. Some providers don't do their notes right away. They might do them every couple of weeks. So let's say on April 15th, we submit visit for John Smith for April 1st and April 8th. Same diagnosis codes for both visits. Let's assume you're reimbursed $80 per visit for a total of $160. If you paid 7%, you would be paying $11.20 for those two visits. But if you are enrolled for our Platinum service, you would pay a maximum of $3.99 for that claim. Now, a billing service charging a percentage will argue they fight hard to get your claims paid, but in reality, follow-up is needed on only 2 to 3% of behavioral health claims. If you submit 100 claims during the month, you would be overpaying on the 97 to 98 claims that are processed without any need for follow-up. And we even have an interactive form on our website. If you go to mbpros.com/save, you can calculate how much you can save by switching to MB Pros. We do have an introductory special offer for Sessions Health and TherapyNotes users. You will receive the first 2 months free with our standard per claim rate with a limit of 100 free claims per month. To receive this special offer, all billing must be done inside of Sessions Health or TherapyNotes. Then you save 10% for the first year. So for the Platinum service, if you submit 0 to 499 claims per billing month, you pay only $3.59 per claim. If you submit 500 or more claims per billing month, you would pay only $3.23 per claim. For our Premium Plus service, you'd pay only $2.61 per claim if submitting 0 to 499 claims during the billing month. For larger practices submitting 500 or more claims during a particular billing month, you would pay only $2.24 per claim. And if you have a smaller practice, you will also save 10% off our minimum monthly fees after the first 2 months free. So for the first year, after the first 2 months free, the minimum fee is only $179.95 per month under the Platinum service and only $89.95 per month under the Premium Plus service. That does conclude our webinar. For more information, you can go to mbpros.com/therapynotes if you're a TherapyNotes user, or mbpros.com/sessionshealth if you're a Sessions Health user. You can email us at info@mbpros.com. If you want to meet virtually, one-on-one, pressure-free, you can schedule a meeting at mbpros.com/virtual. And again, if you want to see how much you can save, go to mbpros.com/save. And finally, of course, you're more than welcome to give us a call, 877-762-7767. Again, thank you for attending this webinar.